Alright guys, this is Jerningham here. My two other videos have crashed, so I've not put them onto YouTube. This one should work. Don't know if it's to do with the memory, but I've deleted the memory. I've had something to eat as well, so I feel much better myself. I'm going to be filming a video on YouTube, putting that onto YouTube of the news. Nothing wrong with advertising the news and talking about it, even though most people see the news around the world and some people probably don't. If they have time to, or they do other things. You know, not everybody watches the news, some people do. Sometimes it can be interesting, other times it can be depressing, the news. But anyway, I'm going to play the video.
Not to be...
I'll tell you a minute.
Some people will have cognitive and psychological effects, almost like PTSD, after an episode like that, and I'm sure it will influence his own personal thinking.
Boris Johnson has revealed in a dramatic series of interviews in The Sun
Phone's not focusing properly again.
Preparing to announce his death from COVID-19 because he was so sick.
What is going on with this phone?
With the virus. So, of course, that does show that things were far more serious.
You guys can see it. It's going so blurry.
Health than we were led to believe at the time, which has got us thinking: will this impact how Boris Johnson?
Why is the phone so blurry like this?
The lockdown, maybe in a more conservative manner as we head into phase 2. Let me bring in Dr. Hilary Jones. Hilary, what did you make of this interview? And do you think that Boris Johnson's brush with death is going to impact the policy-making decisions from now on?
Yeah, hello, Dan.
See, the phone's so blurry.
Obvious that you don't get as far as critical care and intensive care unless you're very sick indeed. And clearly, the Prime Minister was at the time. They, I think, considered ventilating him, but he managed to survive without the need for ventilation, which is a major step. And clearly, he was very sick indeed. And I think that it's very few people can go through an experience like that and not to be very much influenced by it, not to be touched by it to a degree whereby you certainly take it seriously. Some people will have cognitive and psychological effects, almost like PTSD, after an episode like that. And I'm sure it will influence his own personal thinking. But I imagine that the decisions that are made about easing lockdown will be made in cabinet or through COBRA meetings with scientific advice from several inputs. So I don't think it'll be just him making the decisions. I think he'll look at it in a measured way, but he will be only too aware from a personal experience that this is a very nasty virus, a very lethal virus for a proportion of the population. And I'm sure he will be very cautious in putting people's health before economics, but in a balanced way that is as reasonable as it can possibly be.
Now, Dr. Hilary, lots of talk in the news today that there could be hope about a reliable antibody test. So I'll get you to address that during our first question from Leslie Giddy. And Leslie asks, do you know how long antibodies for COVID-19 last in the body, and how close are we to an antibody test for the general population? Well, there's hope for Leslie now, isn't there, Dr. Hill?
There really is, and this is the kind of one of the holy grails we've been looking for throughout this pandemic. We've wanted to know to what extent people are immune after they've suffered from COVID-19 and how long that immunity lasts. Now, we don't know the answer to the second question because the virus has only been around for 4 months. So we won't know for some months to go how long immunity lasts. But we're much nearer to finding a reliable antibody test. It's been known for some time that there have been antibody tests around, but they just haven't been reliable enough. Only 70%, some of them, have been reliable enough, and that just isn't good enough because it would give a lot of people the idea that they're immune when they're not, that when they haven't had the virus. And for other people, it would tell them that they haven't had the virus when they have. So an unreliable test is worse than no test at all because it can be dangerous. in that situation. We now have, maybe 2 weeks away from Roche Diagnostics, a test which is 100% sensitive and 99.8% specific. In other words, it won't give false negatives and it won't give hardly any false positives, which is exactly what we want. It's reliable, it's accurate. And another test being brought forward in Edinburgh, doing the same thing, is just as reliable. And NHS tests will be able to carry these antibody tests out on a blood sample and tell much more accurately whether someone's had the virus and has immunity. And then when we do serial tests, we'll be able to find out how long that immunity lasts. So there is good hope for optimism that in just a few weeks we will have many, many thousands of antibody tests that will give people the information that we need.
Very promising news. Tiga Besson asks next, how can we avoid COVID-19 when we return to work?
Well, we need to be really vigilant because we know that the virus will still be circulating. Just because most of us have been in lockdown doesn't mean to say
So
the
the
virus
phone keeps
has gone
going
away.
blurry all the time. I don't know why.
Hundreds of thousands of people have been at work, and they've had to have been at work. We needed doctors and nurses and delivery drivers and cleaners and porters and public transport workers, people driving trains and buses. We needed them all to stay at work, paramedics and police, hundreds of thousands of people. And of course, the virus is still out there circulating. So when we come out of lockdown, we will need to be careful about reducing our risk of transmission of the virus. And that means regularly washing our hands. It means keeping a social distance from other people, whether we're going back to work or just going to the shop. We will need to continue to do this for some time, until such time that we have an effective vaccine that is safe. And, you know, for people who are in the high-risk groups and the vulnerable groups, even more important to stay vigilant, to be careful, and to stay at home as much as possible.
And the last question today has been sent in by Mary Rankin.
Hi, Dr. Hillary. I have a question for you. It's in relation to visiting a coronavirus test centre. Can you get coronavirus by visiting the test centre? And could you get coronavirus from the test itself? Thank you.
Well, Mary, the answer is you can't get it from a test kit. The test kit is sterile. It's been sealed. It's completely 100% safe. And it'll be delivered by a trained person. The swab is taken of the nose and the throat. And that person will be protected, wearing a mask and keeping a reasonable distance from you. So the risk of having the test is minimal, absolutely minimal. And the second part of her question, Dan, was...
She also wanted to know whether you could get it from visiting a test centre.
Yeah. Wherever the test centre is, whether it's a test that's been sent to you at home, whether it's a mobile unit that is coming to your place of work, whether it is in a hospital, or whether it is in a care home or a test sent to your home, it is a completely safe test.
Great news. If you have a question for Dr. Hillary, you can use the hashtag AskDrHillary on social media. Or if you want to go to our website, you can do that too, thesun.co.uk/Dr. Hillary, or talkradio.co.uk. And Hillary will be here answering more of your questions tomorrow. So Hillary, we'll speak to you then.
All right, Dan, look forward to it.
Well, that was quite an interesting, whatever that was anyway. Let's see here. I'm going to go for the 4 hours ago of Matt Cox's speech, UK Secretary.
The number of spare critical care beds in the NHS is 3,413. On the latest figures, there have been 1,291,000 tests for coronavirus, including 85,186 tests on Sunday yesterday. 190,584 people have now tested positive for coronavirus, an increase of 3,985. 13,258 people are in hospital with coronavirus. and 28,734 people have died. That's across all settings, an increase of 288. That figure is lower than at any point since the end of March. But, as with testing, these reported figures tend to be lower over the weekend, so we do expect that number to rise. And remember, this is not just a number, but it is a constant, insistent reminder that we must go further and faster in our national effort in dealing with this virus.
Still going to go up anyway, regardless of what he's saying. So it's 28,734 people that have died in the UK. And there's all sorts of different numbers that he's talking about. And it could go higher in the summer, who knows? So, yeah. It's one of those things. It's very saddening for a lot of people, but it happens though. Right, go for Michael. Go for something Gove. Michael Gove.
1,206,405 tests for coronavirus have now been carried out in the UK, including 76,496 yesterday. Overall, 186,599 people have tested positive. That's an increase of 4,339 cases since yesterday. 14,248 people are currently being treated in hospital for coronavirus, compared to 14,695 yesterday. Sadly, of those who have tested positive for coronavirus across all settings, 28,446 have died. Behind the numbers, there's been an increase of 315 deaths since yesterday across all settings. This pandemic has claimed more than 28,000 lives, and each one of them is precious, each one valued, each one irreplaceable. The pain of bereavement and heartbreak is deeply personal. But as a society, we're showing care and compassion across boundaries, offering support and a chance to talk through grief together. And for those experiencing the first
Michael
round
Gove
of
says the total of numbers reported COVID-19 deaths, all settings yet used, rise by 315 to 28,400
and the Jewish community
and 46 yesterday. This is yesterday's news mixed in with today's news. So it's gone up today.
And must adapt their religious and cultural
It's gone lower today, like 200 today as well.
We've all learned to adapt, and we must carry on doing so after the Prime Minister sets out how we will get back to work later this week. His comprehensive plan will explain how we can get our economy moving, how we can get our children back to school, how we can travel to work more safely, and how we can make life in the workplace safer. But before we can ease the existing restrictions, we must ensure the government's 5 tests are met, that the number of cases are falling, that death rates are declining, that the NHS has what it needs, and that measures are in place to stop a second peak overwhelming the NHS. I'm particularly conscious that those in the front line of our public services will need clear guidance on safe working. They'll need the right personal protective equipment and appropriate access to testing if we are to make all the progress that we want in the weeks ahead. We're consulting with employers and unions, professionals and public health experts to establish how we can ensure that we have the safest possible working environments, and the Prime Minister will be saying more later this week. On personal protective equipment for key workers, we are increasing the spread of distribution and supply. From February the 25th to May the 2nd, we had delivered over 1.08 billion items of PPE across the health and social care system within England, and tens of millions more have been distributed by our colleagues in the devolved administrations. This overall figure includes 149 million masks, 173 million aprons, 2 million gowns, and 614 million gloves. On the 2nd of May alone, we delivered an additional 20 million items of PPE within England. But there is much more to do, and the work led by Lord Dayton to improve domestic production of PPE is vital to our efforts. And on testing, thanks to the hard work of so many across the NHS, Public Health England, our pharmaceutical sector and our universities, we have tested over 200,000 key workers and their families, allowing those who don't have the virus to go back to work and protecting those who do. We have now, of course, extended the criteria for testing beyond key workers to anyone over 65 displaying symptoms and anyone who has to travel to get to work. And this week, we will be piloting new test, track and trace procedures on the Isle of Wight, with a view to having them in place more widely later this month. All of these steps will help us to get more people back to work and help to support the delivery of our public services. And I want to thank those who've done so much to maintain the provision of critical public services during this crisis. Our teachers have worked incredibly hard to provide educational support to millions, and the government has committed £100 million to boost remote learning for those who need it most. Our newly launched Oak National Academy is supplementing all the work going on by schools and teachers by providing 180 video lessons each week. And we're particularly keen to help vulnerable and disadvantaged children carry on with their education during the pandemic. Schools continue to receive additional funding in the form of the pupil premium for those pupils who most deserve it, worth around £2.4 billion annually. And we've ordered laptops to help disadvantaged young people who will be sitting key exams next year. We're also providing laptops and tablets for those children with social workers and care leavers to help them stay in touch with the services they need, keeping them safe and supporting home learning. And if disadvantaged secondary school pupils and care leavers who are preparing for exams do not have internet access, we will provide free routers to get them connected while schools are closed. Over the Easter holidays, we were able to ensure that more than 60% of schools were open every day, with places for both vulnerable children and those of critical workers. And the free school meal voucher scheme ensured that children who needed it could continue to access food despite school closures. So far, 15,500 schools have placed orders for vouchers, of which over £35 million has been redeemed. The latest available data shows that around 49,000 of the children in attendance on April the 24th were classed by schools as vulnerable, more than double the figure from a week earlier. And while this is going in the right direction, we estimate this still represents only around 1 in 10 of all children and young people classified as vulnerable. We want to see this figure go up further, and we're working with local authorities, schools and colleges to provide improved support to vulnerable young people. All this additional support, of course, takes time, puts pressure on existing staff and costs money. That's why we've pledged an additional £1.6 billion to councils across England to support their essential frontline services, including adult social care. This sum takes the funding given to councils to over £3.2 billion to help communities through this crisis. We've also deployed military support to assist the public sector. The COVID support force mobilised by the MOD is now 20,000 strong. Today, over 3,600 personnel are deployed in support of 86 separate projects in which military aid is being given to civil authorities. On a national level, they're helping the Ministry of Housing, Communities and Local Government, the Department of Health and Social Care, and also the NHS, with planning and logistics in England, Scotland and Wales. On the ground, they're helping to build and to staff the temporary Nightingale hospitals and to operate both regional testing centres for coronavirus, of which there are now 49 around the country, and also the mobile testing units that we are rolling out. To date, there are 77 of them. Across the country, 156 military planners are embedded at grassroots level with our existing local resilience forums. Emergency services, local authorities, the NHS, the Environment Agency and others. They're helping to coordinate and to protect our vital local services and supplies with the additional support of senior Whitehall officials. In addition, we have to thank local government for their energetic work, because since the end of March, 90% of rough sleepers known to councils have been made an offer of accommodation, reassuring them about their safety. And the government more widely is also working hard to support those who have not been identified as shielded, but are still vulnerable. In the coming days, we'll be delivering our 1 millionth parcel of essential food to those at highest risk.
Plenty of likes, please. Plenty of likes. We want more of these likes. None of these down likes. Boo. More likes, thank you. Thank you, thank you.
Isolated. In our communities, the support put in place by many local organisations has been inspirational as people step up to help friends and neighbours. And the government has helped to mobilise another important lifeline through the NHS Volunteers Responders Programme. Over 600,000 people have had their ID verified and are helping with the daily errands that make
Here's my fun like in a hand in hand.
making contact with the human voice on the end of the telephone, and transporting patients and supplies for the NHS. And of course, we are all working with supermarkets to ensure that a greater number of online delivery slots are made available to those most in need. In every one of these areas, the government in Westminster has been working with ministers from the Scottish Government, the Welsh Government, and the Northern Ireland Executive. This has helped us to monitor and react to the path of the virus across the nations, enabling us to intervene wherever people are in need. At each of these daily press conferences, we've paid tribute to the compassion and dedication of our key public sector workers. I recognise how much we all owe to their stoicism and steadfastness. Nurses, doctors, porters, cleaners, paramedics, pharmacists, care home staff, prison and police officers, teachers, social workers, those preparing and delivering food, collecting our refuse, and administering our welfare system. They deserve our gratitude. They deserve our support. They are in all our minds. They are the very best of us. We owe them so much, and we in government will do everything we can to support them during the next phases of our pandemic response.
Well, that was Michael Gove's speech and Matt Cox's speech on here. Hope you all enjoyed the video. Give it a like, give it a comment, share it with your friends. Nice to catch you guys and girls in the next one. Thank you for joining me. Peace. And you know it, now you know. See you in the next one. Peace. No.